Hey there, Dr. Chris again from Intera Chiropractic. Thank you for staying tuned. By now you've probably watched the first two videos going over the 9 major reasons as to why we take full spine structural films when they're necessary. We went over the first 6 reasons. Today I'm going to go over the 7th, 8th, and 9th reason as to why. Now the 7th major reason we take full spine film, so 7, is we want to evaluate for if there's any ligament damage that may have taken place. Now a lot of times people might have come in that have been in a motor vehicle accident. Now a lot of times we've heard of whiplash. Whiplash is very traumatic, and it's a terrible thing to experience because the symptoms can last for quite some time. But a lot of times we'll see when someone has whiplash, the areas on the top of the neck and the base of the neck all the way to the middle back are the ones that actually become the problem areas, because really where the ligament damage occurs is within the middle of the neck. Now if we just go to where there's symptoms in that middle neck, we could actually be causing more injury versus actually healing and repairing that area. So it's absolutely imperative we're able to see how everything relates to each other, especially after an accident, to see what's actually leading to more instability in those areas where the ligaments are damaged and what we can do to make sure it can heal up as quickly as possible. Now the 8th major reason is going to really evaluate for any pathology, and basically what I'm talking about is maybe somebody has cancer and they don't even know yet, God forbid. Unfortunately, there's been situations where someone has come in, unfortunately and fortunately, where they had something as simple as lower back pain, and then we took actually set of films of their spine and found out there was something more serious going on, and we had things evaluated by another professional, and we got them to the right people they needed to see, whether it be an oncologist, neurologist, their primary care doctor. So that really allows us to make sure you're actually in the right place at the right time and you're seeing the right care provider at that time. Another thing along the lines of pathology, it could be things such as osteoporosis, where we have low bone mineral density. Now some people might think that's not safe for someone to receive chiropractic care, but it's actually quite the contrary. So when we know that somebody has lower bone mineral density, we know just the precise amount of force to make sure that we're reducing any nerve pressure coming from the spine, so that that person can really experience the best quality of life moving forward. And we've taken care of many people that experience osteoporosis. But even something along the lines of spina bifida, we oftentimes see that in the lower part of the spine, where a part of it doesn't actually fuse together like it's supposed to. Now if we didn't have x-rays of that, we wouldn't actually know how to contact that bone a little bit differently, so that we're actually able to safely and effectively reduce any pressure from the nerves leaving that area, so that the body can recover and restore health properly. So that's the 8th major reason. So on the 9th major reason, and the last one, is we really want to see ultimately how it's affecting the function of the nerve system. Now when someone first comes into the office, we would like to do a nerve scan to figure out how the autonomic nervous system is being impacted. And if we see high levels of stress in the nerve system, I want to know how that's occurring, and actually most of the time the patients want to know how that's occurring as well. So when we do take a set of full spine films, we can see what's going on structurally, how that's impacting the spinal cord and the nerves, and what we need to do in terms of actually delivering a very specific and precise adjustment to allow that person to restore and regain their health. So those are the 9 major reasons as to why we take full spine films, and actually how that's the difference in getting somebody well quicker and better, and actually making sure that they stay better as well. So the next video I'm going to go over 3 reasons as to why we might not take full spine films on somebody, because like I said, we want to take films when they're necessary, but if they're not, then there's other things that we can rely on to do that. But I'll go over 3 instances that we might not take full spine films.